Subtle signs of gestational diabetes all women should know. Pregnant women have heard stories about the orange drink they had to drink about 24 to 28 weeks of pregnancy, or have experienced it firsthand. It's a narrative about the drink's extremely sweet, syrupy flavor and having to wait in the doctor's office for blood testing that's passed down from woman to woman. However, the inconvenience is well worth it for this vital check. In pregnant women, it identifies and diagnoses gestational diabetes. According to the American Diabetes Association, about 10% of pregnant women have gestational diabetes. But before we begin, don't forget to subscribe to our channel and hit the bell icon so that you won't miss any of our amazing videos. Untreated and mismanaged gestational diabetes can offer substantial health hazards to your baby, including excessive birth weight, respiratory distress syndrome, premature birth, blood sugar levels were low at birth and later in age, baby is more likely to get type 2 diabetes. Now let's get to the signs of gestational diabetes women who have conceived a baby, or are planning to, should know. 1. Excessive thirst is always a warning sign. Your blood volume increases during pregnancy, and you require extra water for amniotic fluid, the protective layer inside the womb that cushions the baby. Pregnancy also causes you to sweat and boosts your body temperature. Because of these variables, Dr. Donald Grant, a general physician in the United Kingdom, says it's natural to feel extremely thirsty while carrying a child. So, when should you be concerned? If your thirst is unquenchable, to the point that you can't stop drinking no matter how many bottles you down, then you have gestational diabetes. Pregnant women are encouraged to drink between 8 and 10 glasses of water each day as a general guideline. If you think you need more, have your blood sugar levels checked. 2. An urge to urinate frequently. Another strange sign of gestational diabetes is that you will begin to pee a lot. As previously stated, you must drink plenty of water while pregnant to avoid dehydration. After all, you're serving 2 or more people. As a result, it's natural to feel the need to pee frequently. However, if you have heavy urinating, which is different from the light flow you had in the first few weeks of pregnancy, it's a serious problem. If you see any of these signs of gestational diabetes, see your doctor right away. 3. Fatigue and tiredness. It's vital to note that fatigue and tiredness are 2 separate concepts in medical language. Unfortunately, most of us get them mixed up. So let me start by defining the difference. Tiredness is a normal occurrence that can affect anyone. Like after an hour of laundry, you could feel exhausted. You relax for a time and resume your normal routine. Fatigue, on the other hand, is more akin to being tired all of the time. One that does not improve despite relaxing or getting a good night's sleep. You're tired all the time, especially shortly after getting up, and you have a terrible lack of energy. As gestational diabetes warning sign, high blood glucose levels can make you feel extremely tired. You will be drowsy and tired for no apparent reason. 4. Previous diabetic pregnancy. If you've had previous pregnancies with diabetic symptoms, you're at a higher chance of contracting it again. According to a study published in Diabetes Care, up to 69% of women who have had gestational diabetes before may experience a recurrence in subsequent pregnancies. The same study also found that, if you needed insulin to control your blood sugar during a previous pregnancy, it's possible that you'll need it again. So, how does this affect you? Be aware of your medical history and exercise caution during your subsequent pregnancies. Make it a habit to monitor your blood sugar levels on a regular basis. Keep your eyes peeled for any early indicators of gestational diabetes in your body. 5. Infections, a major concern. The most distressing sign of gestational diabetes is the possibility of repeated pregnancy infections. I'm not talking about minor diseases like the flu. I'm referring to serious conditions like candida, a yeast infection that affects the vaginal area. According to a 2016 study, about 75% of women will get candida at some point in their lives. Uncontrolled blood sugar levels have been linked to a higher risk of yeast infection in many studies. Diabetes weakens your immune system and makes it easier for viruses to infiltrate your body. Candida produces severe discomfort, dryness, and a curd-like vaginal discharge, as well as agony during intercourse. Furthermore, because you'll be thirsty a lot throughout pregnancy, dehydration makes your body's yeast infections worse. If you have thrush or yeast infections frequently throughout pregnancy, you should have your blood sugar checked since it could be a sign of gestational diabetes. 6. Hunger or hunger pangs. The truth is that most pregnant women with diabetes don't pay close enough attention to their nutrition. Rather than eating a balanced, nutritious diet, we frequently give in to our junk food desires. As a result, not only does blood sugar rise, but so does weight, increasing the risk of gestational diabetes. However, if you consume a healthy meal yet still feel hungry, it could be a warning sign of gestational diabetes. This illness increases your appetite and makes you crave unhealthy snacks. As a result, it is recommended that you eat enough breakfast, lunch, and dinner every day. To help keep hunger away, make sure you're getting enough fruits, veggies, and proteins. 7. Diagnosed prediabetes. Being prediabetes is a clear sign of the dangers of gestational diabetes during pregnancy. Prediabetes is a condition in which your blood glucose levels are higher than normal, with the potential to progress to diabetes. So, if you get pregnant, there's a good possibility you'll acquire diabetes during your pregnancy. While you're pregnant, pay extra attention to your nutrition and lifestyle. 8. Polycystic ovary syndrome. PCOS women are more likely to experience gestational diabetes, miscarriage, early delivery, pregnancy-induced hypertension, and kids with a more birth weight. To reduce the likelihood of these issues, women with PCOS should work closely with their physician during pregnancy. Because PCOS produces high glucose levels, many doctors advise pregnant women with PCOS to have a gestational diabetes screening before the 20th week. 9. Nausea and vomiting. Nausea and vomiting are less prevalent in people with type 2 diabetes, but they are extremely common in those with type 1 diabetes. What about in the case of gestational diabetes? When it comes to nausea and diabetes, there is a disease known as gastroparesis. The medical word for delayed stomach emptying is gastroparesis. It can be tough for your stomach to empty itself naturally if you have it. As a result, you're more likely to feel satisfied sooner. It's also possible that this will produce nausea and vomiting. 10. Blurred vision. Both short-term and long-term effects of diabetes can cause blurry vision. Long-term vision difficulties are caused by blood vessel damage in the retina of one or both eyes caused by high blood sugar levels over time. These issues aren't going away anytime soon, but treatment can help them proceed more slowly. Blurriness caused by high or low blood sugar levels is only transitory and will go away as the sugar levels return to normal. 11. Your sugar levels are affected. Certain dietary cravings may be triggered during pregnancy, affecting blood sugar levels. So, while you should entertain your demands throughout pregnancy, which you should, I also recommend that you engage in regular activities to minimize the negative impacts. Begin by establishing short goals for your health. Don't put your body through too much stress. For starters, don't you think a regular prenatal yoga regimen would be beneficial? Here are some popular natural strategies to control gestational diabetes: regularly checking your blood sugar, bringing blood pressure back to normal, and maintaining a healthy weight. Take drugs to help you control your blood sugar. Prenatal yoga or exercises are examples of daily physical activity. There's something magical about being a pregnant woman. It's unforgettable to carry a child inside your womb and watch it grow and develop into a baby. However, issues such as gestational diabetes can emerge throughout this period. Those who are at a higher risk should be proactive rather than waiting for things to happen by accident. Eating a fiber and protein-rich diet, as well as getting lots of exercise, may assist to keep this condition at bay. It's also a good idea to keep an eye on your blood sugar levels when you're pregnant. We hope you liked the video. If so, hit the like button and share it with your loved ones. If you have any questions or comments, let us know in the comment section below. Also, don't forget to subscribe to our channel for more of our amazing videos. You can also watch our other videos suggested just for you. See you in the next video.